stakeholders in the medical aid sector, including companies implicated in the Section-59 report, say that they will engage with the panel that conducted the probe. The report found that Discovery, Medscheme and GEMS had racially discriminated against black, coloured and Indian medical practitioners. So for more reaction on this, we're joined on the line now by Dr Katlego Mothudi, who is the Managing Director of the Board of Healthcare Funders. Dr Mothudi, thanks for your time. Welcome to Morning Live.
Morning, Sakina, and thanks for having us.
Before we even get into the merits of that particular report, can we just locate you and your organization in all of this? So please tell us more about your organization and your members.
Yeah, the Board of Healthcare Funders is an association for health funders, which includes medical aid administrators and managed care organizations. Although most of our work is in terms of articulating health policy on behalf of these organizations in collaboration with policymakers and governments, we do play a big role in terms of, firstly, articulating efforts to fight fraud, waste and abuse. We have a unit called the Health Forensic Management Unit, which assists these entities to share information to enable them to detect fraud. The second area is that we are also responsible for registration of healthcare practitioners as well as health facilities so that they can claim from schemes.
Now, just getting to that report, Dr. Mothudi, the report, of course, found that between 2012 and 2019, there was racial profiling, which resulted in black healthcare practitioners, the fact that they were found to be more likely to have committed fraud, waste and abuse of these particular healthcare funds. Is what the report ultimately highlighted, and that abuse was in contrast with what was found against their white counterparts. So what do you make of those findings in as far as you have interacted with the report?
I think it's important to say off the offset that such a finding is concerning and nobody would be in support of any form of racial discrimination. You would remember that when this thing was launched, it was on the back of complaints by healthcare practitioners, largely complaining about unfair treatment and also a bias towards certain races. We have been part of the process, and I think it's also highlighted in the report that all the participants actually got together voluntarily, submitted information. So there has been broad collaboration and cooperation from the industry. So the intention was always to get to the root of this problem. It is concerning, but what we also note is that the panel could not find any deliberate act or deliberate unfair treatment by the named entities. So in terms of the way forward, as outlined in the presentation by the chair, is that the named entities will be given a 6-week period during which time they would then give comments on these allegations. It is also important to say that while we recognize that fraud, waste and abuse is a huge problem, the industry loses tens of billions of rands every year. It is important that we operate inside the prescripts of the law. So already some of the recommendations have been taken seriously. I think the panel recognized that even before the conclusion, they had started seeing some changes in terms of the approach. So our view is that we should not be at opposite ends, and I mean from the medical aid industry with the healthcare practitioners. We should look at this as a systemic challenge with structural problems that need to be addressed and that need all parties to come on board.
So how would you, from your perspective, describe the fraud, corruption and malfeasance within your sector from what you have observed over the years, Dr. Mothudi?
When you look at the profile of fraud, and I must also hasten to say that the actual fraud that is committed. It's committed by probably a handful of practitioners. So most practitioners actually operate within the law. We must also accept that it's a fairly complex industry. We've got 78 medical schemes. Each one of those has got rules. So there is bound to be confusion in terms of various processes. But having said that, we need to make sure that we take fraud serious. So there are cases of blatant fraudulent activity. The majority of activities that are noted are submission of false claims. And this is where claims would be submitted on behalf of beneficiaries for services not rendered, or where the services that were rendered are misrepresented. And then we also have various other types of fraud in terms of identity fraud, where somebody masquerades as another person, or you bring in a relative on your own fraud. So that's typically what the type of fraud that we see. So in terms of what we do from our side is that we make sure that we share as much information as possible to try and expedite first the identification and also the investigation of fraud. In terms of quantification of fraud, the figures that I've been about, we talk about fraud, waste and abuse accounting for about 15% of the gross contributions, which works out to be just under 30 million rand. Actual fraud is estimated to be anything from 3 to 6%, maybe 8 billion rand also. So it is a major problem that requires that we pay due attention to.
So in that regard, you say that you can attribute the fraud to a handful of medical practitioners, and that statement juxtaposed against the panel and their findings. How would you describe that? Do the two correlate, firstly? And also, what action do you believe should be taken against those who are actually implicated in this report? Because the reality is, Dr. Mothudi, that practitioners have actually suffered, and many of them have lost their livelihoods, and we understand some people may have even taken their lives over what has happened to them over the years.
Yeah, and that is quite unfortunate, Sakina. That's why I started by saying that we cannot defend any unlawfulness. So just to come to your question about how to correlate the extent to what we've seen. The report does acknowledge that fraud is a challenge, and that needs to be dealt with. But to get to the handful of practitioners that commit fraud, there has to be some sort of profiling, which is the challenge that we face today. So you'll go through mountains of data to try and identify. And then they use certain algorithms that looks at, I think it's a popular way these days, of outliers. Now, in that process, there would have to be some sort of verification. It does not mean that every wrongful claim or deemed to be wrongful would be fraudulent. Some might fall in the category of error. And that's what has been noted as well, is that after identification, there's often engagements, and these engagements can lead to final determination of whether a particular deed is indeed fraudulent. And that's where you find that schemes or administrators would ask for additional information from practitioners. So it's a sort of a filtration or maybe distilling. You probably start with identification of tens of thousands, but you only find that maybe hundreds are eventually found to have done wrongdoing. In terms of the way forward, I think there's a lot of information sharing that is required, and not just within one sector that is like the medical aid schemes. It's also important that there is an understanding that is brought to the practitioners in terms of the processes. The report does say that. They say that we must make our processes public. We must make sure that any engagement we have with the practitioners is conducted in a mediated fashion where the issue of or the feeling of bullying that is often reported is minimized, because it does bring some stress to a practitioner when they have to sit in a room with a large company that is representing the scheme.
So, Dr. Mothudi, this, of course, the investigations spans 7 years between 2012 and 2019. And as you yourself pointed out earlier, healthcare practitioners have been complaining for a long time about this unfair discrimination. So in a nutshell, what are you saying in terms of the action that should be taken against implicated medical schemes? Because the question is, should we just now move on and forget about the harm and the prejudice that was visited upon healthcare practitioners?
I think there are some important points to consider. So the data that was used does span that period of time, 7 years. The allegations of discrimination were reported only early on in, I think, in 2019. So that became a new angle, and that brought agency through the Office of the Minister and the Council for Medical Schemes to implement the panel. So the investigation itself has been active for, I think, just over a year. I think it started in February of last year. So in terms of recourse, drawing back to the report is that the panel said it was not their mandate to look at each of the allegations. So they had a more global view of what is happening, and they look at processes, etc. I think it is still important at some point that we engage with each and every one of the complaints, because to offer a blanket solution on the individual ones might also be maybe erroneous on our part, because we might sweep certain things under the rug. I think
but Dr. Mothudi, you're not answering my question. Let me phrase it differently. Should there be action taken against medical schemes as a result of some of the findings in the final report when it gets to that?
Definitely, I agree with you. And the panel also pointed out that there should be oversight by the professional bodies and the regulators. I think they talked about the Health Professional Council's role, as well as the Council for Medical Schemes, that when there are complaints that are reported against these entities, the council must actually investigate timelessly and then bring some relief. So there's no doubt that if there is wrongdoing, it must be dealt with.
And you said that your organization has zero tolerance for any form of discrimination. So what efforts have you made from your side to actually investigate behavior of this kind?
So other than participating in this process, we also have looked at our policies and procedures, because when an organization becomes part of the health forensic management, there are agreements that are signed. And we have looked at where there have been deviations. And obviously, we will look at this report and when the final version is released. When there is concrete evidence of wrongdoing, those entities can be subjected to further review to see to what extent they have contravened the rules of engagement with the health forensic management unit.
Dr. Mothudi, we'll leave it there for today. Thank you so much, Dr. Katlego Mothudi, Managing Director of the Board of Healthcare Funders, talking about the interim report on racial profiling by medical aid schemes. And this story has, of course, been a big one. And since 2019, when the spotlight basically was shone on this particular matter, but it didn't start then. I suppose it just got to a point where the affected practitioners couldn't take it anymore.